Welcome to another short from the Vet Med Digest. Our historical quest to understand bone health began with rickets, an ancient disease successfully treated using sunshine and cod liver oil. This led to the discovery of vitamin D, whose highly active form, calcitriol, was fully recognized in the early 1970s. We also understand parathyroid hormone's role in calcium homeostasis, noting that while its chronic elevation causes bone loss, its intermittent use is an anabolic treatment for osteoporosis. Recent research shows this hormone does more than regulate minerals. It modulates cellular energy metabolism, promoting aerobic glycolysis and fatty acid oxidation in bone and adipose tissue. The control of phosphorus was clarified by the discovery of fibroblast growth factor 23, FGF23, in 2000, a hormone from bone that drives phosphate wasting in the kidney. In canine medicine, nutritional rickets is typically seen in young dogs fed all-meat diets, resulting from defective bone mineralization due to poor calcium to phosphorus ratios. Primary hypoparathyroidism, likely due to an autoimmune condition called lymphocytic parathyroiditis, causes acute, severe hypocalcemia and neuromuscular signs like tetany and seizures. Because the lack of the parathyroid hormone impairs renal conversion to active vitamin D, treatment requires high doses of vitamin D3 and calcium supplementation. Regarding canine gastrointestinal disease, a study on protein-losing enteropathy found that supplementation with cholecalciferol, vitamin D3, raised 25-hydroxyvitamin D levels in affected dogs. However, this failed to provide a clinical benefit compared to placebo. Crucially, almost half of the placebo dogs corrected their vitamin D deficiency with standard therapy alone, suggesting treatment of the underlying intestinal disease resolves the issue. Nonetheless, 5 dogs, 18%, developed elevated vitamin D levels, warranting cautious dosing and monitoring. In horses, 2 major endocrine disorders often overlap: equine pituitary pars intermedia dysfunction, caused by a loss of dopamine inhibition leading to hypersecretion of peptides and hypertrichosis, and equine metabolic syndrome, defined by insulin dysregulation that is strongly linked to laminitis. Equine mineral disorders include nutritional secondary hyperparathyroidism, big head, from calcium imbalance, which stimulates excessive parathyroid hormone secretion and leads to bone loss. Furthermore, critically ill foals often suffer from low vitamin D, and severe outcomes are associated with abnormal levels of fibroblast growth factor 23 and its cofactor, clotho. Thank you for listening. The link for the full podcast is below. Remember to like, share and subscribe if you enjoy this kind of material. From Vet Med Digest, where we keep minds inspired, hearts light, and tails wagging.